Hey y'all, let's talk about the 5 biggest causes of maternal deaths for Black women in the US. My name is Dr. Fatu Forna. I am an OBGYN who works to keep pregnant women safe here in the US and around the world. Black women, you need to know the top causes of maternal deaths for Black women specifically, so you know how to prevent them. It's important for you to know that the causes of death, the top causes are different between Black women and white women here in the US. What's killing Black women is different. The risks are different, so let's talk about them. Number one, the biggest killer of Black women during and after delivery or pregnancy in the US are heart conditions. 40% of all of our deaths, so nearly half of all of the deaths for Black women is heart conditions, also called cardiovascular conditions. This includes heart attacks. It includes hypertensive complications of pregnancy. You will hear them have different names: preeclampsia, gestational hypertension. It includes something called cardiomyopathy, where your heart, it might be damaged from something and it's not pumping as strongly as it needs to pump. So heart conditions is number one. That's the most important condition that kills us in pregnancy. For white women, heart conditions is not number one. For them, it's number two. It's 23%. But for Black women, 40% of all those deaths. We need to be aware of that. Number two, blood clots causes 12% of deaths in Black women. This is all according to the CDC. It's blood clots. They're also called thromboembolism. That's a medical term. And there are different types of blood clots. There's something called DVT or deep vein thrombosis, those are blood clots in the big blood vessels inside your legs that can break off and go to your heart or lungs or brain. They can cause a stroke. Something called a pulmonary embolism, where they go to your lungs, they block it, and you have problems with breathing. They can cause, a lot of problems in your different organs. So blood clots, the second biggest cause of death, 12%. Number three, bleeding. We also call it hemorrhage. Accounts for 11% of all deaths for Black women. Hemorrhage, there are different forms. There's postpartum hemorrhage that happens after you have the baby and you keep bleeding and don't stop, and you lose a lot of blood, your heart stops, and that's how you can die from losing too much blood. There's something called placental abruption, where during the pregnancy, the placenta just separates and starts bleeding, and you can lose the baby, you can die if that happens. It's an emergency. It can be caused sometimes when your blood pressure is high. So most of those bleeding concerns can happen after the pregnancy, postpartum hemorrhage, but a few of them can happen while you're pregnant, and those are big causes of maternal deaths, 11%. Number four is infection, also called sepsis. Accounts for 8% of deaths for Black women. It's when you get an infection in many different places. It can be in your womb. It can be, in your kidneys. It can be in many different places, and then it goes over your whole body, causes your organs to shut down. That's what's called sepsis. So a major infection can cause that. Like I said, your womb, your uterus, your wound. Maybe you had a C-section. We check for urine infections because we don't want you to have an infection in your kidney. So many things can cause infection. Number five is mental health conditions. That accounts for about 7% of deaths for Black women. So including depression, most women have the postpartum blues. Some even have depression, anxiety, that can all lead to suicide. Substance use and abuse and overdose deaths. So number five cause of death for Black women are these mental health conditions. But of note, for white women, this is the number one cause of death. It causes 35% of their deaths. So mental health conditions, number one for white women. For Black women, it's number five. But Black women, number one is heart conditions. We need to know about that. There are other causes of death that account for 5% or less. Injury, including homicides, that affects about 5% of Black women. Strokes, 3%. Something called amniotic fluid embolism, where something from the baby, the amniotic fluid, some particles get into your lungs and just make you, you collapse and your heart stops beating and you die. That's one of those tragic deaths that it's very hard to prevent. So amniotic fluid embolism causes 3%. Cancer or other medical conditions, they all account for 2% of less. So those are the main causes of death for Black women. Heart conditions, cardiovascular conditions, number 1. Blood clots, thromboembolism, number 2. Bleeding or hemorrhage, number 3. Infection or sepsis, number 4. And number 5, mental health conditions, including suicide and substance use. All right. So Black women, heart disease and hypertensive complications are our number 1 cause of death. Big cause for us. That's why you're going to hear me talking so much about preventing obesity and stress and controlling your blood pressure, because those are the things that have a high chance of killing you. And we need you to know these things and know how to prevent and treat them, because we need you to survive and thrive. All right? Okay, y'all take care. Bye.